the other thing that jumped out to me, and again, we can't get into the minds of the regulators and what they were thinking exactly, but there was another criticism, and it kind of follows the same with the addiction.
We actually can. We actually can by just talking to them. I mean,
Yeah.
we are talking to the European regulators, and you get a lot also of them on scientific conferences. Not necessarily all of them go to like psychedelic conferences, but some go to neuroscience conferences, psychopharmacology conferences, and then they talk and then they write papers. And I mean, it's pretty much open out in the space, the skepticism, and maybe also not so sciencey decisions on side of the regulators that are more political. We can see it in the European space. I'm sure we can see it in the FDA regulatory space too.
Mm-hmm. So there is you have some advanced notice then maybe of what they're going to be looking at and what they're going to be focused on, what their concerns might be.
At the moment. So that's also our European, again, I don't know if this is helpful for the American perspective, but on the European side, we've just finished that episode study that we were working on for more than 3 years, and we are heading towards a potential phase 3 approval study. Mm-hmm. So that means for almost 2 years, we are now talking to regulators. And we see how they evolve and how they perceive the US American data and what their skepticism is. And I would just more have the very conservative people, or not so much the conservative, like the maybe people with emotional reactions to everything that others call a drug. In my mind, this is not all rational. So a lot of people, even if they have professor titles and work in regulatory bodies or universities, they have prejudice like all of us, and they have emotional attitudes that you need to speak to. Some people just are scared of drugs still, no matter how advanced your own thinking about drugs, psychoactive substances may be. Let's talk to the people who are afraid. Yeah.
And ease their concerns. Yeah. Because that was one of the things, again, that stuck out to me in reading was, there was a lot of commentary about, well, the addictive side, but also, mixing, if patients were to mix these with alcohol or something like that. And as I was reading this, I was like, I mean, but we've done this before. Antidepressants, lots of different drugs have that concern and have gone through approval. So in a way, I was thinking, well, how much is this just not an understanding of the compounds themselves, or putting an extra sort of filter on that might be, from stigma or something else about these drugs, because they were once considered, recreational. Like that's their sort of, they didn't come through that typical pharmaceutical lens, but maybe at what point do we have to, trust the patients, trust the therapists, rather than sort of try to over-regulate all of these behaviors?
Well, let me quickly talk about some of the complexities in the kind of data that we do not have. So there is a transition between maybe self-administered drug use and therapeutic drug use, obviously after MDMA therapy. And also after psilocybin or DMT or 5-MeO-DMT therapy. So there are several questions coming from that. Are we socializing patients into a certain subculture? Or are we socializing or modeling a certain kind of use or attitude towards these therapeutic compounds? Also, so to be clear, I believe that MDMA can have a very therapeutic effect. But even people who might have received it once, twice, 3 times in a study may, after some months, feel the need to have a refresher or want to do something or have a growth motivation. So what are they doing? So this after the studies phase is seriously underinvested, and the data that we have here is scarce. And this is where there is a field where people often also, some people, a part of the study population may go to subcultural or drug dealing structures. And this is where people get concerned. And it's a complex field. I mean, we have already talked about it. So reforming the drug field and how drugs are provided in society, and maybe even thinking more concretely about how to fulfill the needs of people who might have a tremendous improvement through psychedelic therapies, but then after months or years fall back, or they even might have gone into, might have tasted some of the potential growth and self-development impulses that these substances can have on people. So this is something I would look at very clearly and talk to regulators about openly. And they might react with, so that's what some of the European people we talked to have reacted with. Okay, we understand that. We also see that in other drug trials. We feel that this is an open conversation, and we somehow through follow-up studies need to get an impression on what are people doing after therapy. And of course, we also need to encourage people to report truthfully and not build a relationship to study participants that insinuates, yeah, you've gone through a tremendous therapeutic process. Now you owe us not to report on what you do afterwards. This is, I think, not the way that we should go on.
Yeah, that's a really good perspective, actually, and I didn't consider that when my initial reaction of reading the some of the committee findings and stuff. And I think that's a good point, because it's almost like you were saying before, trying to do two things at once, because there is this movement. And I'm not saying that you guys are, I mean, I think, again, I'm not putting words in your mouth, but the psychedelic community on one hand doing the medical approval process and all of that, there's also an opening up of conversation about these compounds outside of a medical context, and a lot of it pertains to growth, personal growth. And so, yeah, I can see the point where someone who has gone through a therapeutic trial, a medical trial, tightly supervised, everything like that, but they felt this, maybe this power, this sort of this feeling that can be provoked by these substances, and then would want to, do that again, maybe 6 months, a year later, that kind of thing, or they have another experience, or maybe they're even telling other people about that experience. And I think that's...
Or maybe they're diving into the psychedelic subculture or community, literature or space or workshop environment, and book their tickets to the Amazon and talk to Brad about what they did in the Amazon, or talk to a newspaper, and then it's out. Yeah. And there needs to be some kind of reasonable commenting on that, on some, and talking to the regulators about that. If they do their job, they are reading that in the media and wherever. We need to develop an understanding of what people are doing there and what future regulation needs might be.